Are you making these mistakes taking an AREDS 2 vision supplement? Recent research has come out showing there are several flaws with the AREDS 2 formula. But first, what is AREDS? AREDS stands for the Age-Related Eye Disease Study, and they wanted to see if they could slow the progression of age-related macular degeneration, AMD for short. The first AREDS study was based on 500 milligrams of vitamin C, 400 IU of vitamin E, 15 milligrams of beta-carotene, 2 milligrams of copper, and 80 milligrams of zinc. By consuming these ingredients at these levels, they were able to slow AMD progression by 25%. But then, two large trials were funded by the National Cancer Institute, which found that beta-carotene may increase lung cancer for people who smoke or have smoked. And the people from the AREDS trial who smoked or had smoked showed a higher incidence of lung cancer. So they redid the study, removing beta-carotene and including 10 milligrams of lutein and 2 milligrams of zeaxanthin. The switch slowed the progression of AMD even more. This became the new standard, calling it AREDS 2, because it was the second iteration of the study. However, now they are finding issues with zinc in these amounts. Both studies contained 80 milligrams of zinc. The problem, this is twice the maximum daily amount of zinc recommended by the National Health Institute. This amount of zinc may cause stomach pain, higher rate of urinary tract infections, and kidney stones. Zinc can also at these levels interfere with the absorption of certain medications like antibiotics and antiviral drugs. It can also inhibit the absorption of iron and copper, which may lead to anemia and nerve issues in the hands and feet. So if you're experiencing any of these issues while taking AREDS 2 formula, talk to your doctor. To help combat these issues, Bausch & Lomb suggests taking the AREDS 2 formula partly in the morning and part in the afternoon. But this creates several problems. You're still taking twice the maximum daily dose by the National Health Institute, and you could be doing more harm than good. When the DNA of the original AREDS participants was analyzed in 2013 by Dr. Raphael Kustra from the University of Toronto and by Dr. Bernard Rosner, professor of medicine in the Department of Biostatistics at Harvard Medical School, they discovered that zinc in these amounts can be harmful to certain genetic profiles. Carl Ah, MD, a retina specialist from Nashville, Tennessee, said the AREDS supplement was beneficial for most patients, but almost 15% did worse with the treatment than with the placebo. This adverse outcome appears to be due to the high dose of zinc in the AREDS formulation, which would also include the dose in the AREDS 2 study. Second, many people forget to take the second dose, which cuts all the benefits in half. What can you do? Well, the National Eye Institute also did a study based on the AREDS 2 formula, but with 25 milligrams of zinc.